So 6 months before you go on Medicare, you're going to start getting notices from the government as you approach Medicare. You're going to start getting booklets from all the different plans available in the area. It's going to be stacks. You can look at them, or you can bring them in and we can help you talk about them and examine some choices. And if you want to proceed with a broker, we can get you in touch with someone that's worked with hundreds of our patients to help them pick a path that works for them. Really though, it breaks down to two things. Everybody gets Medicare Part A and Part B. And from there you have decisions to make. You either use Medicare Part B, get a traditional supplemental, which tends to pick up everything that Medicare Part B doesn't, and then pick a Part D as in dog drug plan to cover your prescriptions, which is path one. Path two is what they call Medicare Advantage, which in our marketplace is UPMC, Highmark, or Aetna. And they combine the medical and prescription coverage together. So if you're a heavier user of healthcare services, or if you travel, traditional Medicare with a supplement is by far the best route to go. As long as the provider takes Medicare, they're gonna take your supplemental. It works in Pittsburgh, it works in Florida, it doesn't really matter. With your Medicare Advantage plans, you have to choose a little wiser, because if you're gonna be a snowbird, you need to make sure that what you've chosen for Western Pennsylvania works in Sarasota as well. But that coverage does tend to be cheaper on a monthly basis. We've been dealing with Medicare Part D since its inception. We can always help you pick a Part D drug card. What we'll do is take your medications, run them through Medicare software, and based on the medications you take, show you your best options. Because look, there's $7 plans, there's $10 a month plans. But if they don't cover your medications, then it's really not worth your time or effort. The other thing you have to be aware of is once you go into Medicare, whether it's a Medicare Part D card or Medicare Advantage, you get $2,700 towards your prescription drugs on an annual basis. So if your prescription's $100 and you have a $10 copay and the insurance pays $90, that $100 comes off of your $2,700 bucket. If you take all generics, usually you're okay. As soon as you add an insulin, you add an inhaler, a brand name heart medication, you start to run into what they call the donut hole. So once your drug spend between out of pocket and the insurance company goes over $2,700, you go into the donut hole. Once you're in the donut hole, you're responsible for 25% of the total price. The health insurance plan picks up the other 75%, which may not sound like a lot, but when your box of insulin is $500, you're looking at $125 for that box of insulin when you're in the donut hole. Until you hit the other side of the donut hole, in which case you're in catastrophic coverage and you drop to a percentage of the total price. The other thing we try to do here at Curtis, all of our Curtis locations, is talk to you about the Pennsylvania PACE program, which if you're aware, you're not aware, it's funded by the lottery. There's income limits, but if you fall below those income limits, it keeps you out of the donut hole. We'll bill your Medicare plan, whatever's left over goes to PACE, so the most you'll spend is $15 on a brand name and $8 on a generic. Come in and talk to us, call. We can explain your options, try to help you get started. We are not a broker. We will not sign you up for a program, but we can get you in touch with people to help. You need to be careful who you work with, because if you talk to someone and without them talking to you, don't ask questions about your health usage and right away recommend a plan, you can usually guarantee that they're getting a higher commission on that plan. You want to talk to someone that examines all your options.